My name is Jesse, and this is intradermal injection. First, I would have my MAR, and I'd have the doctor's reason for the injection. Today, we will be giving Mr. Smith 5 units of TB for his TB testing. I would come to my cart, perform hand hygiene. I will then look at the equipment that I will be needing, and seeing as how I'm giving 5 units of TB, I will take my 1 milliliter 29 gauge half-inch insulin needle. I'll also have my purified protein derivative, 5 tuberculin units. Expiration date is good. I will also have some alcohol swipes for disinfecting asepsis. I will then check the TB units up against my MAR to make sure it is everything that I want it to be. Expiration date is good. I have the time, which is today. I have the route ID. I have the amount, 5 units. I have the med, and I have my patient. So then I will open up my syringe away from me, pull it, uncap, and seeing as how I'm doing 5 units, which is 0.5 milliliters, I will draw up 5 units of air, insert in the bottle after I wipe it, and then seeing as how we can't actually do injections into the pad itself, I will actually not be pulling up the liquid itself, but after I push the air into the vial, I will then tip it and draw up my 5 mLs, 0.5 mLs. I will then take my med, take my MAR, I will lock everything back up in my cabinet, I will dispose of any garbage that I need to. I will then come to the patient's room, I will again check my med, check my units. I will then knock on the door, introduce myself. Mr. Smith, can you give me your first name and your birthday, please? Perform hand hygiene. Mr. Smith does respond with his birth date and his name. I will also check his band, and it is indeed who it says he is. I will then close the curtain, elevate the bed. I will then instruct Mr. Smith as to the reason for the TB check. We are actually just doing a check to see whether or not he's got TB. I will ask him if he's got any allergies. I will again check his band for any allergies as I'm looking for my injection. Come around. I will lower my railing. I'll then instruct Mr. Smith if there's any itching at the site after the injection is done. That will be part of my assessment. I will put on my gloves, elevate my table, I will uncap my needle, discard in the sharps container. I will look for the bevel side. I have my injection site. I will clean that with an alcohol swipe in a circular motion. I will allow that to dry. I will then make the skin taut, inject or insert at a 5 to 15 degree angle, about 1/8 of an inch. Inject, look for a wheel, pull out, discard in the sharps container. I'll then instruct, which I won't be throwing that in the sharps container because I'm going to need that. I'll then instruct Mr. Smith not to scratch, not to massage that site. And then I will come back to reassess him in about 48 hours to see if he's got a mark any bigger than a centimeter, centimeter. I will then raise the railing, cover Mr. Smith, discard my PPE, lower Mr. Smith back to a comfortable position. I will lower the table back down, perform hand hygiene, and then I will document my results in his book. That is intradermal injection.